Welcome to the beginning of this year's session on shoulder and elbow. My name is Marlis Sabo, and I'm a shoulder reconstruction surgeon based at South Health Campus. This first podcast is a quick snapper to explain the intent, scope, and organization of the rest of the podcasts comprising this session. So the overall goals of this session consist of immediate and long-term. For most of you, the top two will be all that fills your windshield at this point, and that's fine. However, the material included is also intended to grow with you. At its fullest scope, all the materials, including the clearly labeled optional content, will be sufficient to allow you to function as a primary care provider in a way that serves your patients well. Hang on to this material because I've curated it to get it all the stuff in one place and make it easy to use in the not too distant future. There's also material here that will be helpful in your small group learning. For any session, objectives are needed. These are the specific course 2 objectives for any of these body part specific sessions. By the end of this session, you should be able to apply anatomy and clinical patterns to make a differential diagnosis, be able to explain mechanism, etiology, and features of selected common traumatic and atraumatic conditions, and to be able to define the role of common investigations and the treatment pyramid. These topics are either not relevant yet or will be covered elsewhere. Finally, this copyright statement is true for all the podcasts in this cluster. Finally, how should you approach the material? Since you're already watching this podcast, I would recommend moving to the Foundational Information podcasts. Ideally, the applied anatomy should be review with some refocusing for clinical application. The radiographs talk and accompanying slides in the handout will be useful for the small group cases and later life in general. The rest of the talks are a series of patient stories that embody classic or archetypal patient presentations to provide a hook to remember how the various pieces fit together. The handout reflects the format and ordering of the original intact lecture presentation and is designed to be an all-in-one place resource both for right now and for later on when you run into shoulder and elbow patients in their natural habitats. Finally, we will have a live office hour Q&A session where we can dig into questions arising from the material. Please keep a running list of your questions and bring them along.